Hello. Thank you for joining the BRI Care Consultation webinar this afternoon. My name is Gail Alston. I'm the Director of the RCI Training Center for Excellence, and I appreciate your interest in providing evidence-based supports to the caregivers in your community. At RCI, we believe that this is the best way to support the caregivers in the important work that they do in their homes for their loved ones. For the next few minutes, I will share details of the Benjamin Rose Institute's Care Consultation program. The Rose and Carter Institute has partnered with BRI for the past 3 years in providing care consultation through area agencies on aging in the state of Georgia. We have had impressive positive outcomes for those served and are continuing our partnership by providing training and certification in care consultation around the nation. We believe it is a powerful and cost-effective alternative to traditional case management. We'll begin by talking a little bit about key components. Any evidence-based caregiver intervention has the components that they feel are critical to bringing about the positive results that they expect. And these are the components for the Care Consultation program. It is an empowerment model, which means it uses coaching, and it provides for skill building for the clients that they're served. It's not a here's the information, it's here's the information, how do you utilize that information, and then empowers the caregiver so that they will be able to do this type of thing after the intervention is over. We also teach some problem-solving skills. We link the caregivers to the services and then provide follow-up and oversight to be sure that they successfully access those services. We explain rather complicated things like insurance and what legal options are there. If we don't know the answers, we will find them out and get back to the client with that information. And this is what's so important, that one-on-one delivery, telephone delivery of the intervention. Because then the caregivers, the clients, can ask those specific questions that they have that they might not be able to get through any other means than this one-on-one intervention. We help them develop effective communication skills. Have you ever felt like you're invisible when you're in a doctor's office, when either you're the patient or you're with a loved one who's the patient? This helps you learn ways to better communicate with your doctors and nurses, other medical providers, and service providers as well. It's a long-term program, which is 12 months long, so you develop long-term relationships with your clients, which is very beneficial to giving them the information they need, the support they need, the power they need to continue to provide their important services to their loved ones. It's both standardized and personalized, which means we cover all bases through a standardized assessment, but it's personalized in which we are able to drill down and really focus on those issues that are specific to the person that's being served. We believe it's more important to prevent crisis than to respond to crisis, so we try to head off potential problems by conducting over a period of time a very in-depth assessment of their needs. Because people don't always look ahead. They're so busy dealing with their immediate problems. And this intervention helps them not only deal with their immediate problems, but also look down the road to try to offset any problems that might be developing. Now, this is a little bit different support system in that it can serve the patient, the client, the person who has a long-term care need. It can serve their caregiver, can serve them individually, or it can serve them both together and as a team during this program, which makes it very unique. Something else is really unique about the Benjamin Rose Care Consultation program is the Care Consultation Information System, which is a computer-based information and record-keeping system. We just think it's the greatest thing since sliced bread. We really felt like this was a strong reason to continue using CCIS through the area agencies on aging. It not only stores the data, but it also generates reports, and it also helps lead the interventionist through the intervention or the consultant through the intervention, giving them prompts to help them remember things. This is a great fidelity assurance tool because if the consultant isn't adhering correctly to a protocol, this system will send them alerts and reminders so that they can get back on track with the number of calls, the timeliness of the calls, and making sure that they're also following up on all the action steps that are in place to best serve that caregiver. Everything the consultant needs to know about the client is right there in front of them. It's just a click away. This will give you our opening screen for the CCIS. I'm not going to get in depth with the CCIS, but as you can see, we have, you can go into cases, you can go, this is where you can export the data so that you can have data analysis. Also, you can generate different reports that are needed in the delivery of the intervention and supervision of the intervention. There's a satisfaction survey that's used for program evaluation. It's a great tool with a lot of, we really think it's a comprehensive tool that makes it easy to adhere to and to provide the intervention. There are 3 steps in the CCIS that you're led through the protocol. You begin with an initial assessment. Now, the thing that's really cool about the care consultation assessment is that it's not your usual, here's a list of questions, ask them, get the answers, and then after you do all of this, you can move forward with helping the caregiver. This is a triage method of assessment, which means that there are certain trigger questions that you can ask. They're simple. They're yes or no questions. And then once you find those areas that's of the most immediate concern to the caregiver, that's when you drill down with the detailed questions. And you don't go through all the trigger questions in that first conversation. You identify what is foremost in this caregiver's or this client's world that they need assistance with right now. In fact, you might not even have to ask a question. It could be that the caregiver or the client will come online and say, you know, I'm calling today, I'm in a panic, because usually that's what does make them call, is when they're in a crisis. This is what I need help with. And the care consultant can immediately start working with that caller, the client or the caregiver, to come up with some action steps and some problem-solving skills that will address what is foremost in their mind right then. Before they hang up that one call, they will have action steps in place that will help them start solving that problem, addressing those issues immediately. That brings us to the action plan. And the action plans is very important they're very simple, they're very direct. It's a step-by-step plan for addressing whatever that number one priority was. It's also very specific, and it's provided in writing, either through email or through snail mail to the client or the caregiver. And the steps are very achievable. They're short steps. You're taking baby steps through this process, and they are assigned and with a timeline attached. So this is very concrete what has to be done. The care consultant tries not to be the person who has to carry out the action steps. Of course, sometimes they have to be. Sometimes that's very appropriate. But as a rule, part of the empowerment is to make sure that the client and the caregiver are doing as much as they can for themselves, so the next time they face such a problem, they will have the confidence to know that they'll be able to address it on their own. Maintenance and support, because it is a 12-month program, you do build a long-term relationship with the client. But we do that not by a constant, intense intervention for the whole 12 months. As you see in the very beginning, it's more intense. Every 2 weeks you're going to have a phone call for the first 2 months, and then it's spaced out over the remainder, although you can, if a crisis comes up, if you feel there's a need, you can increase the contacts. These are the minimum contacts made by the care consultant during those periods of time. I spoke to you about the triage assessment. You have up to 4 months to get through all 22 of those triage trigger questions. And you do that, and then you're going to reassess using those same questions, trigger questions, again at the end of before the end of the 12-month period. So you are getting through the assessment. You're making sure that you're hitting all those points, but you do it over a period of time so you're not overwhelming the caregiver with too many questions or too many action steps at one time. You're taking them, you're prioritizing them with the caregiver over that period, but you do make sure that they've all been touched on by the end, at least twice by the end of the intervention. So what do care consultants do? We've talked about the fact that they conduct this very broad assessment. They're putting together these action plans. But I think the critical thing off this slide is that it's guided by the client's concerns and preferences, and that the care consultant and the client become a team. They collaborate with each other in identifying what's most critical and developing those action steps. And then the care consultant, they do a great job of following up. Have you been able to do this yet? What are the barriers? They're troubleshooting with that client. They're identifying, have you tried this? Well, if that didn't work, let's try that. You're really the coach. You're coaching them to address these issues in a very specific, concrete way. Another really good news part about the BRI care consultation is that it's very cost effective. The care consultant, they are professionals. They can be social workers, they can be nurses, they can be any bachelor's level employee, staff member that has the experience. We do recommend they have experience in working with long-term care issues, caregiver issues. If they don't have the experience, you can compensate that through training, mentoring, having a supervisor very involved in the beginning of the process so that they can advise them on those particular issues. We know that one care consultant can effectively serve anywhere from 75 to 125, with 100 being the average. That depends on how much administrative support the care consultant gets in terms of assisting with scheduling appointments, following up for appointments. We say that the average direct and indirect time per client per year is only 6.27 hours, getting a really good impact with a little bit of time. The average annual cost, $1.03 a day or $376 a year. And that cost analysis was based on having a full-time care consultant in place in the Atlanta, Georgia region. So when you added their salary, their fringe benefits, and their indirect cost, that was at $60 an hour. So you can make adjustments up or down based on your location. Now we're going to talk a little bit about our results. Looks like they're a little bit difficult to read there. Apologize for that. We have a decrease in number of emergency visits from 2.25 to 1.73, and a decrease in number of hospital visits. Now, if you're a caregiver, you know that if anytime you can avoid going to the emergency room or to the hospital, your life is easier. And it also directly impacts the cost of care. So these are two very important outcomes. Additional outcomes, which did not show up on my slide, but I want to share with you, was that we saw a substantial decrease in number of unmet needs, which also speaks to the fact that working with a care consultant, the clients and the caregivers are able to identify resources they were unaware of before, and were able to have some of the needs that they had been not having met through these contacts and through the follow-ups. There's also improvement in caregiver self-rated health. The caregiver's health does improve during the course of their participation in the intervention, basically due to the fact that that care consultant is reminding them to put as much care and attention in their own health as they do in the person that they're caring for. These additional positive outcomes include improved care for the client themselves, a delay in nursing home placement. We believe that by increasing the meeting the needs that they have and also the support that they get, we're bringing about these substantial improvements in quality of life. Caregiver depression is something that over 50% of caregivers experience. Reduction in that is probably one of the critical pieces that leads to the delay in nursing home and in improvement care for the care receiver. Over beyond these data-driven, evidence-based results, we also have personal testimony. The clients that are served by Care Consultation, here's a quote: "Thanks for all of your concern and knowledge. You have no idea how important it is for me." These are the types of things that Care Consultants hear on a regular basis, and it helps them know beyond the data that they are doing a great service to the people they're providing the service to. if you're interested in bringing Benjamin Rose Institute Care Consultation to your agency, we do have training packages provided through the Rosalind Carter Institute's Training Center for Excellence. A training package includes that we would train, the training takes 1.5 days. We'll train up to 10 people. We certify up to 4 people. And the reason we train more people than we certify is that best practices indicates that you should really train anybody who's going to be involved with the delivery of this service, from the people who will be answering the phones when people in the community hear about it and call to inquire, on through the supervisors, on through the top level managers in the agency. Everyone needs to know as much as possible about this intervention in order to ensure its successful implementation through your agency. It's important to note here that with this contracted in this package, should you have turnover, and let's face it, turnover is a big problem for implementing new programs, because you get a person trained and then 6 months down the road that person relocates, they drop out for whatever reason, you lose that person, and then you have to go back and go to the expense of training new people. The Rose and Carter Institute understands that from implementing programs ourselves, and so what we've done is we've added in this training and certification for up to 4 new interventionists hired during that first year if they've been hired due to staff turnover. We hope that that will really help in the successful implementation. We also provide monthly consultations as requested by the agencies, so that should some intervention delivery issues come up, we will be there to help you resolve those issues. We don't just train you and then let you go and hope that you do well. We are partners in you being successful in this intervention. The cost of the intervention is $8,000. That includes all the training manuals, the installation of the Care Consultation Information System software on your computers in your agency. Additional costs would be the transportation, lodging, and meals for the one master trainer who would come to your site to provide the training. If you prefer to send your care consultants to Americus, Georgia for training, the cost remains the same. Of course, then you would be providing the cost for their transportation, lodging, and meals rather than for the master trainer. We believe that this is a very cost-effective way to provide training to get these services out across the nation. If you have any additional questions, I hope you will contact me at the Rosalind Carter Institute. My number's there, our website's there, and at the bottom of the screen you will see my email address, gayle.alston@gsw.edu. We're very excited about the success we've seen with Care Consultation through our implementation sites in the state of Georgia. We see it being a wonderfully effective and low-cost alternative to traditional case management that truly improves the quality of life for the care recipients and the caregivers that are in the community. Thank you for your attention. I hope to hear from you soon.
Thank you. Please stand by.